You are being played. Do you understand what's happening? You are absolutely being played. Less than a month ago, on Inauguration Day, the World Health Organization, after conferring with the United States CDC, came out with a twofold directive in order to have less false positive tests regarding COVID-19.
The World Health Organization speedily backtracks on its coronavirus testing methods. On Wednesday, the WHO announced its previous PCR testing protocols were potentially producing inaccurate test results, which may have been dramatically inflating the numbers of COVID infections.
Throughout 2020, doctors and hospitals and clinics had been encouraged, if not pressured, to make the diagnosis of COVID-19 if we thought it was probable or presumed. We didn't have to have a positive test.
Rick, did you say people who weren't even tested for COVID-19 had that listed as their cause of death?
If the doctors thought they had symptoms of COVID, they listed COVID as the cause of death.
And the symptoms were extremely broad-based. Cough, low-grade fever, shortness of breath. We see that a lot with colds, with allergy seasons, certainly with influenza. But that's all we needed to diagnose COVID-19. And that's why you saw influenza numbers plummet in March of 2020.
And this, as you said, does apply in many other places. I was just looking at the conditions in the UK from the Geriatric Society there, and you can have the sniffles and you're deemed to have COVID. And here it's a little more, smaller, more narrow definition. You can have sniffles and a cough, and then you've got COVID. So these were set right from the beginning of the pandemic. At least in Ontario, they said that anybody, if in a long-term care home specifically, or in a congregate setting for seniors, one person could have one symptom, and then the whole long-term care home would be deemed to be an outbreak, and anybody else who got any sort of symptom was deemed to have COVID. So if they die, they're therefore also deemed to have COVID.
So on Inauguration Day, the World Health Organization came out and said, one, physicians and hospitals and clinics should make certain that a patient with symptoms consistent with COVID-19 needs to have a positive test matched up to that syndrome of symptoms in order to diagnose COVID-19. Well, you know what's going to happen. That's going to eliminate a lot of the cases, because no longer is it going to be enough to look at a patient that's got a cough or low-grade fever and say, well, you've got COVID. Now it's got to be symptoms consistent with a positive test. The other thing that the World Health Organization was strongly encouraging was PCR testing should no longer be running at cycle thresholds at 40, 44, 45.
The WHO released new guidance for laboratories around the world, reducing the cycle count in PCR tests to get a more accurate representation of COVID cases. The WHO said specifically that, quote, careful interpretation of weak positive results is needed. That means that the cycle count, which shows how much of the virus is in a person's system, was set far too high, resulting in any level of particles being declared a positive case.
It should be reduced into the realm of what we normally would use, understanding that PCR was never created to diagnose a viral disease, but we've been using it to diagnose COVID-19, and we've been abusing it because we've been running the cycle so many times that in some studies, it was projected that possibly 85% of the positive PCR tests were false positives, such that 1,000 people being told that they have COVID-19, it was likely that less than 200 of them actually had COVID-19.
This is something that's very interesting, and it speaks to the cycling. And this is directly from the paper. We've talked about the cycling. They go right in. This is probably the most concise description I've ever seen. And they say about the cycling, if someone is tested by PCR as positive when a threshold of 35 cycles or higher is used, as is the case in most laboratories in Europe and the US, the probability that said person is actually infected is less than 3%.
Whoa.
The probability that said result is false positive is 97%. And that's the PCR test that's being used really everywhere throughout the world.
This is what's driving the lockdown, right? I just saw, California, you're not allowed out of your house. You can't get in a car. You can't get on a bicycle. You can't do anything because the PCR tests are showing that there's this dramatic increase in cases.
Some breaking news now. In the UK has recorded almost 3,000 new cases of coronavirus. 2,988 cases were confirmed today. Now, that compares with 1,813 cases yesterday. And that takes the UK's total number of cases to 347,152.
So there you have it. Two things happened on Inauguration Day that were virtually guaranteed to lower the number of cases of COVID-19. We're seeing data previously distorted willingly, now being told, don't do that. And another thing, we're seeing a remarkable drop in the percentage of total U.S. deaths caused by cancer and heart disease.
Well, last month, the CDC released figures showing the vast majority of people who were listed as dying from COVID-19, 94% of them had other morbidity conditions, on average 2 to 3 other potential causes of death. Now we have numbers from Milwaukee County that may be even more startling. As of this past Sunday, 410 out of the 422 deaths there attributed to COVID-19 occurred in patients with other underlying potentially deadly health conditions.
A remarkable drop in the percentage of total U.S. deaths caused by cancer and heart disease. I wonder why. Do you think we found the cure to cancer and heart disease?
97% suffering from diabetes, heart disease, leukemia, colon and prostate cancer, and more. Most had 2 to 3 conditions. Some had 5 or 6 serious illnesses, but all of them were listed as COVID-19 deaths.
You're being played. Have a good day.